15 minutes after the top of the hour, the re-election of President Barack Obama guarantees another 4 years of government growth, many say. Well, that's mostly due to the landmark health care legislation, the Affordable Care Act. And as the bureaucracy gets bigger, your coverage could actually get smaller. Here to help us understand the new law, Betsy McCaughey, author of the brand new book, Beat Obamacare. Good morning to you, Betsy. You've been an advocate of explaining what Obamacare is all about. You always come prepared with the entire bill.
That's right.
And luckily your book is a lot thinner.
That's right. The book is actually a no-spin, easy-to-understand guide for people who know nothing about health insurance or health care except what they've experienced themselves. But there are big changes ahead for everybody. For example, most Americans get their health insurance at work through their own employer or their spouse's employer, but they may be losing that coverage this year because the law requires, beginning in 2014, that employers with 50 or more full-time workers provide coverage, not just any coverage, the government-mandated one-size-fits-all plan, which will cost about twice as much as what many employers currently offer. So some employers are going to say, I can't afford that, I'll pay the penalty instead. Other employers are going to push workers down to part-time status to evade the law altogether. But if you're dropped at work, it doesn't mean you're going to be uninsured. You're not going to have that option because when you file your taxes, you're going to have to attach proof that you are in a government-mandated plan.
Wow.
So you will, if you earn too much to be eligible for Medicaid, you will have to go shop on the state health insurance exchanges.
So these health insurance exchanges, we were talking in the commercial break, a lot of this is rolling out now. It's kind of
They'll be open in October.
They'll be open in October.
And most people have never heard of these, but they're like an 800 number, a website, and a DMV-type office. And they only sell the government-mandated plan. It's like going to a supermarket that only sells cereal or a car dealer that only sells four-door sedans, no hatchbacks, no convertibles.
Right. So they dictate what you're going to get, which is your point number 3, right? They dictate exactly. I thought that Obamacare was supposed to give us more choice, or at least what the president always said is you'll be able to keep what you have.
No, there won't be more choices. There really will be no choice. There'll be bronze, silver, gold, and platinum, but all those plans have benefits. Only the copays and deductibles differ.
Okay, now the government will dictate how doctors treat patients. What do you mean by that?
That's right. Section 1311 puts the federal government in charge of your health care for the first time. Even if you have a private plan you paid for yourself, the Secretary of Health and Human Services can still dictate what doctors do, what kind of information they collect from you, and what kind of treatments they provide.
I know you're concerned about doctor shortages as well, but let's talk about seniors. They're going to get less care?
They're going to get less care because, believe it or not, cuts to Medicare pay for more than half this law. So the chief actuary of Medicare warned that some hospitals will stop accepting Medicare. Where will seniors go? Other hospitals will have to spread nurses thinner to make ends meet. And on average, according to the actuaries, a senior will get about $1,431 less care per year by the end of the decade than if the law hadn't passed.
And that's scary because there was already an issue about doctors not taking Medicare, right?
It's going to get worse. And worst of all, probably, the money that's not being spent on seniors, it's going for bureaucracy. The spending on government administration, bureaucrats telling doctors what to do, is going to soar from $28 billion to $68 billion. So, unfortunately, not money to make people better or to prevent illness.
Wow. If you want the easy-to-read guidebook on what may be ahead, check out Betsy McCaughey's new book, Beating Obamacare. Thanks for explaining it so well to us.